Hello, everybody. Thank you for being here this afternoon. Unfortunately, today has been the deadliest day in our fight with COVID-19 since this pandemic came to our county. We have had 5 deaths since yesterday. This brings our total of neighbors that we have lost to 17. Those who have died have ranged from being in their 50s to their 90s. We had 3 males with 2 females, 4 Caucasian neighbors, and 1 African American neighbor. Needless to say, this is a tough day. Our thoughts and prayers are with the families of everyone who we've lost in this process, specifically those who we've lost this week. We now have 579 positive COVID-19 cases. Reminder, once you have a positive case, even though we have many people who recover, we always track that positive case number. This is up from 563 yesterday, 16 new cases since yesterday. It's been a month since we had our first positive test. It feels like a lot longer than that, but it's been a month where we've been living with this virus together, experiencing new things together, and going through what is a real struggle. We have been averaging over the month 19 positive tests per day. Right now we have 52 individuals in the hospital, representing 18% of our active cases. This number is up 4 individuals from yesterday, but the percentage remained the same. So essentially, this is holding true, this number between 18 and 20% of our active COVID cases, 18% to 20% of them end up in the hospital. We have 20 individuals who are critical, representing 7% of our active cases. Some demographics on those hospitalized: 31 are Caucasian, 12 are African American, 3 are of another race, and there's 6 people that we just don't have the demographic data on right now. So today we have 279 people who have recovered from COVID-19. If you look at our graph here, that's the green line. The yellow line is our active cases, and I believe the red is our, let's just make sure, yep, the red is our total case number since for the past month. So status check, 579 positive cases. We're presently monitoring 283 active cases. This is up 5 from yesterday. We have had recoveries. That was up 6 from yesterday. So our yellow curve is slightly ahead of our green curve. We've talked about this process, how we need our yellow curve to flatten out. It essentially is kind of flattened out, but we then need it to drop. And our green curve needs to essentially invert through our yellow curve. It's been trying to do that, but we still have work to do related to starving the virus. 67 individuals in our positive caseload are now household contacts. Again, this is something we've seen. For every 10 positive cases we have, we know we will have probably 1 to 2 new cases just based off of individuals who live in those households. So that trend has been here the whole time. It's holding true. We now have 1,069 people in our community in isolation and or quarantine. This is all of our active cases and any of the direct contacts that people have had with them. Total cases breakdown: 310 are female, 269 are male, 16 are under 19 years of age, 116 in their 20s, 80 in their 30s, 93 in their 40s, 107 in their 50s, 83 in their 60s, 44 in their 70s, 29 in their 80s, and 11 in their 90s. Percentage breakdown: 23% of our cases are under 30 years of age, 37% of our cases are under 40 years of age, 53% are under 50, 71% are under 60, and 29% of our cases are over 60 years of age. Breakdown by municipality: City of Syracuse 236, Town of Clay 64, Town of Manlius 39, Town of Salina 34, Town of DeWitt 33, Town of Camillus 32, Town of Onondaga 28, Town of Cicero 25, Town of Geddes 19, Town of Lysander 18, Town of Pompey 17, Town of Skaneateles 11, Town of Marcellus 4, Town of Atisco 4, Town of Van Buren 4, Town of Lafayette 3, Town of Elbridge 2, Town of Fabius 2, Town of Spafford 2, and Town of Tully 2. We now have positive confirmed cases in every town in Onondaga County, the City of Syracuse. There are no confirmed cases in the Onondaga Nation at this point. What does this tell us? This data, not seeing really any trends other than your more populated communities have more cases. The virus is to the east, the west, the north, and the south, and certainly the counties around us. So the best way to take this virus head on is to starve it and stay 6 feet away from everybody. As we know, the virus can't move further than that at this point. Looking at testing, we've had 7,618 tests administered. 7,496 tests have been returned, with 579 positive and 6,917 negative tests. We have 122 pending tests. We received 199 tests back since yesterday. Our percentages of positives are 7.7% of our tests come back positive at this point. That number has really been consistent between 7.5% and 8%. We are now moving into a new testing strategy related to nursing home employees. We've been working with the potential Walmart site to have a priority for nursing home employees. We've talked to our hospitals about doing some rapid testing in certain nursing homes. And we certainly, out of the 12 nursing homes, I believe we have 12 or 13 in the county, we want to test the employees. So we're making, normally to get a test, you need to meet symptoms. Now we're working with all of our partners so that nursing home employees can get a test no matter what, even if they're asymptomatic. So that's something we're doing, and we're going to be working on why nursing homes. We know with positive cases in nursing homes, they don't come from the residents, they come from the employees. And there's density there. You can see faster community spread if you get one case. This has been an issue throughout the country, throughout the state. New York State Health regulates this. We want to be an active, strong partner with New York State Health. We feel that we need to engage and complement our resources with theirs in this effort. That's why we're doing this. Process after a positive test result. So if you get your test, you're in a quarantine until you get a phone call. You either have a negative or positive. If you're positive, we're going to check you for your symptoms, make sure you're okay, and then we'll begin our investigation into who your direct contacts were while you were symptomatic, potentially even a day or two before that. And then based off of that is how, after our fact finding, remember, we identify, we isolate, we fact find, and then we quarantine. That's where our quarantine comes into place. Because you work at a business and someone at that business tests positive for COVID-19 does not mean you're a direct contact. So unless you hear from our health department, we've deemed that you did not have direct contact. But we have community spread. Regardless, we should all be watching our health each day. We should all be taking our temperatures each day. In the event an investigation, we don't have all the information we think we need. We'll put out a press release. We'll ask the public for their awareness, but also to look to see if they potentially were at an essential business during a period of time. We've done that numerous times. Again, when you look at, when you're through the process, once you've met the CDC and New York State Health Department guidance related to a recovery, you'll hear from our team and our health department about releasing you from isolation, which is if you're positive, or quarantine. Again, numbers, we have over 1,000 people in this situation now. It's not as easy when you had a couple hundred people with your health department. So if you're in a position where you haven't heard from us in a couple days in a quarantine, just reach out, send an email, send a call, use text message, and so we can look at it and try to get you through that process. But we thank you for all your cooperation, and we certainly appreciate your understanding in this process as well. Certainly related to social distancing, we put a voluntary shelter-in-place order about 10 days ago. We think we're getting results, and we're going to ask everybody to hold strong over these next 5 days. We believe by doing that, certainly it will drive data. Everything, all the decisions being made should be made around data from the public officials. And those briefings, you hear that from us. I think you hear that from the governor, and the federal task force is hopefully looking at data as well. And that's how we make decisions about policies related to the public health, but also that's what's going to drive restarts. And so for everybody who's very focused in on a restart, and I feel that anxiety and I feel that pressure, and we can talk more about that, the best way to get the data where we need it is to starve the virus. So I ask for your help to starve the virus. Let's limit our outside activities. Let's do better than 50% social distancing so that our data really makes the case for us regarding timing of a restart. Okay, also the Plasma Project. We want to thank everybody who's participated in that, certainly with Upstate and the Red Cross. This is something our COVID patients have a unique opportunity to help further the fight against COVID-19. We want to thank everybody for that. Part of this process, just like we planned and prepared for COVID-19 weeks in advance before it was even in our country, is planning and preparing for an economic recovery. And part of that's a restart, and that makes people nervous about when we talk about restart. Some people are saying we need to have it now. Other people are saying, how can you even talk about a restart? We can't look at this, but we need to plan and prepare for everything. One of the things we've done in our economic development department, and if you go to our website, www.ongoved.com, on our webpage, we have a Who's Hiring tab where you click on it, and you can click on COVID-19, which gives you guidance under what's essential or non-essential. But on our Who's Hiring tab, you'll see dozens of companies that are hiring, very good companies all hiring right now. So we know that this is hurting people. People are hurting, but there's companies hiring too. So please go to that. Look at the opportunities that are there. Please apply for these jobs. There are some very good opportunities here, and we'll continue to update that weekly for everybody, and continue to promote that, because economic recovery doesn't need to wait for a restart. There's companies operating right now that are hiring right now, and if you're out of work, please look at that and those options. Access to assistance. Our Upstate Triage Hotline, 315-464-3979. I'll have all these numbers memorized by the end of this. I think I already do, but I'll check each day. This is the hotline. If you don't have health insurance or your primary care providers don't have PPE to give you tests, you call this number, you schedule a test for COVID-19, or you get screened to get a test. And then you go to our testing triage site at the Syracuse Community Health Center. Our seniors, our healthcare workers, and adult nutrition hotline, 315-218-1987. Again, we've had many people who are in this new norm of the last 30 days that need help, that never needed help before, whether it's getting a meal, whether it's getting groceries, toiletries. We have an army of volunteers and county employees that have been delivering all these to folks every day. So that's the number you call, 315-218-1987, if you find yourself in a position you need some help that you've never needed before. Child Care Solutions, daycare for our essential business employees. If you find yourself in a daycare crunch, you call 315-446-1220. That is free daycare for our essential employees through April. 211, you dial 211 for social and emotional support. This is tough. This is wearing on all of us. That's a number that you can call and talk to individuals. Vera House Support Line, 315-468-3260. Again, there's never any excuses for abuse. If you find yourself in a situation you're uncomfortable with, please contact Vera House and get the support that you need. Same goes for child abuse. McMahon Ryan Child Advocacy Center, 315-701-2985. Many of our mandatory reporters are not working with kids every day. If you think something's going on, please contact McMahon Ryan. They can help get everybody involved to investigate. Donations of PPE, 315-435-2525. Our protective equipment that we need for first responders, healthcare workers, nursing home workers. Your donations have made a difference in this process. They've helped different organizations when they were down to nothing get that. So again, thank you all for that. And please continue, if you come across PPE that you can donate, please donate them to us. We will get them to the front lines. Again, Volunteer CNY, 315-428-2229. If you want to give back, you want to volunteer your time, you call this number. They'll put you into different scenarios where you can volunteer your time and help with our whole response to COVID-19. And we've had so many great volunteers. I want to thank you all for that. Saying that, we'll take some questions.
5 deaths in 24 hours. That must just be the hardest thing you've had to deliver to this county yet.
Yeah. This is a tough day. The numbers are staggering. I think overall, when you look at our number of cases and what this virus does, our community's fared well in this category to this day. But this is a lot, and it's 5 individuals who have people who love them, 5 individuals who their family members probably didn't get to say goodbye, didn't get to really have a lot of communication. So this is tough. This is really tough, and yeah, it's sad.
Do those numbers come to you at once, 5 different times in 24 hours, or were you updated in a group number that, I just wonder when you saw how bad that 24-hour period was going to be, how you processed it in your own mind?
Yeah, so today, normally I'll get updated anytime there's a death. We knew over the last 72 hours people were really struggling, and so I got updated all 5 at once today. So normally throughout the day you get updated right when it happens, and all 5 at once. So yeah, you're in shell shock a little bit, and this is part of the reality of the virus. And what's so tricky about this virus is that there's hope in the data and the efforts, but the virus is so lethal still that you have to find that balance. And we've had to find that balance as a community throughout this process. And the longer this goes on, it's harder to find that balance because our mental health is being challenged in ways that it never has been. So our public health is always number one. And I think by doing the things we need to do and hunker down, this data is going to get better, and we'll try to find that balance and try to look at turning the page, the next page, what's for us. But this virus is with us, and so it's going to be with us, and this virus is a killer. So finding balance at this time is very, very hard, and it's very hard for people deal with it, and that's the biggest challenge right now.
Is there a pattern in the 5 deaths? Are they, you gave the ages, but underlying health conditions, do you know?
Some of them did. Some of them had underlying. I think some of them did not. So I think what we're seeing now is the first few deaths. And again, I don't have all the details on the 5 because this is all pretty fresh. But our first, most of the victims for a period of time of COVID-19 had underlying medical conditions. We've now seen deaths that people just got really sick from COVID-19. And so for those that are pushing, and again, right now we have 2 narratives, right? Those who are pushing restart very fast, and those who are pushing on the other side, we can't do anything, and this is both fear of the virus and fear of the consequences of the virus, okay? And so how do we find balance with that and make good decisions for the community? That's where our job comes into play. But this virus, you have the physical health fears, you have the damage it's done, the real economic damage, people worried about how they're going to make their mortgage payments. This is another effect that this virus has. So it's human life, it's economic ruin, it's really unbelievable how vicious this virus is.
Do you have any more on how many deaths have occurred at nursing homes?
We had one yesterday, going into yesterday, right? And then I'm under the assumption at least one of these victims was a nursing home death. As soon as we get details, we'll share all those details.
That would bring us to 3 total?
No, I don't know if it's 3 or if it's 2. My understanding is one of the 5 could potentially be a nursing home. Could be more than one. I don't have those details yet.
Have you been able already to get some of the nursing home employees to be tested, or is that still?
Yes, so what we're doing with nursing home testing is we have a dedicated part of our adult and long-term care team reaching out to various nursing homes, including those that have not had any issues with COVID-19. And we want the employees tested. We can box in, and our risk mitigation is actually better for those facilities that have not had any cases yet, because we can identify the virus before it potentially gets into the building. So we're working there. We have great relationships with some of the larger nursing homes. We know the state's been working with one of the larger ones. And so we're working with some of the larger ones too, with our hospitals, trying to get them to work together about doing rapid employee testing. And so we have testing sites in Walmart that they've agreed we're going to give nursing home personnel priority. That could be up and running potentially for a couple small kits tomorrow. And then over the weekend, potentially it ramps up. But then in addition to that, we're not waiting for that. We want to, this is a proactive testing strategy. How can we do it? We have some capacity to do it now, so we're doing it because we know if this thing spreads in a nursing home, it's going to spread in a big way. So we're being proactive at this point.
Just to clarify on the Walmart site, are you saying they're going to open tomorrow?
It could potentially open tomorrow with limited testing. At some point, they got to have a dry, a early test run on it, and I think it could be tomorrow. I'm not quite sure. I have not been able to track back with those folks. I know they wanted to potentially have a small amount of tests done there tomorrow if possible, but I don't know exactly where that is.
Have they told you when they would open up altogether?
I think they're looking to open up potentially tomorrow, but I don't know. If it's not tomorrow, it'll probably be Saturday. But again, they're going to ramp up their testing. They need to go through their process. Their process is different from other people's, and test that process. And we're trying to identify employees to basically send there for that right now.
Are you able to identify any nursing homes that have had positive COVID cases
We're looking to get numbers. There's positive COVID cases in Onondaga County in nursing homes, and the numbers, they're with positive cases, you get affiliated cases, and so we're trying to break out and understand the data and deploy resources where this has happened. This is an area we've said we want to help our partners in New York State on, and New York State is dealing with this everywhere. And so we want to get in front of this before this is a real problem. Other counties are in a situation where they have all their cases are nursing home related. And so they have numbers each day coming in. They're all related to 2 or 3 buildings in their county. So that gives you, if you're reporting like we are each day, and I say I have 16 new cases, that's still an indication of community spread. At some point, when you can figure out the affiliations, it may not be that you have the community spread you think you have if 60% or 90 or 100% are coming from buildings. That means you have a problem in one spot of the community, not the whole community. So we're trying to get our hands on that, working with our partners in the state. We've offered all of our resources to get around, to get our arms around this, so this doesn't become a situation that we've seen in other parts of the state.
How many of our 12 or 13 nursing homes would you say have cases?
I don't know the exact number, Tim, but I'd say at least 3 or 4 of them, probably, maybe even a couple more. So we're trying to get our arms, get in front of all this. And again, you know, your strategy is you box it in, right? You identify, you isolate, you find, and do your investigation, you quarantine. And certainly we're going to do that with our friends in New York State with these nursing homes.
What kind of roadblocks have you run into with the state in regards to the nursing homes?
I think we got a pretty good relationship. It's not our, again, these are my constituents. These are the governor's constituents. We all have our own lanes. Nursing homes is not our lane, but it's a lane that when we see a problem, we can help out with. So we're trying to be a good partner, and we want to do more here because we think we can help. And we've been leading the response to COVID-19 in this region, and this is an area we think we can help out, and hopefully we'll continue to work together and problem solve. One of the ways we do, we got testing capacity. We're going to work to try to get all those employees tested, and then certainly where there's a problem, the state is going to be more involved, I'm sure, where there's a problem. So we're working through all of this. This isn't, if you know, I wish that this was our lane more, because then I could be more decisive, but it's not my lane. So we want to come in and help operate in it, but we don't want to step on toes either. So it's a balance.
Logistically, do nursing homes do their own testing of their residents?
We have given test kits to Loretto. Loretto does their own testing. And I know that the state can come in and do testing in nursing homes when they seem fit. It's probably unlikely other nursing homes are doing testing.
Would patients then be sent to a hospital for a test? What's the process if there's a
You
suspected
could either,
case?
they could go to the hospital, or you could have certain healthcare providers can come and do testing in the nursing homes. That's probably more likely, Andrew, is that people would come in, and we have partners that can do that. They can go into a house, give a test, go into a nursing home, give a test. And that's the likely scenario with nursing homes for patients. We're talking about the employees, getting in front of the employees, because they're the carriers. The patients in a dementia unit aren't going around spreading COVID-19. It's the carriers are the employees. So that's why we want to get in front of the case with the employees and get them tested, even if you're not symptomatic. We want you tested now.
What's the status of the county mortuary?
Yep, we're in pretty good shape. Part of our emergency management plan is we work with the medical examiner's office, we work with the hospitals, the funeral directors. Dan Weirs and his team talk about this. We have some resources from the state that are coming in, and different quality control plans, essentially. So right now it's not a problem like it is in other parts of the state and the country, and we're okay, and we're consistently on calls, checking on status each day. And our role, we have our emergency management team that brings everybody together. Our role is to complement the marketplace where it's needed. If the marketplace in their day-to-day operations gets overrun, then we come in and we play a bigger role. But right now, we haven't had to do that yet. We're still okay.
I got a question from a business owner. He's seeing what's happening with the nursing home employees, maybe going to Walmart. If a company has the resources, what would your thoughts be on them hiring capacity to test their employees, essential or non-essential, before going back to work?
The issue with getting where are they going to get the tests, right? So the tests, having a private sector company try to get tests is very hard. Most of these laboratories for rapid response testing won't even give them to governments. They'll just give them to hospitals. So the second part is it's a moment in time, Andrew. So you can get tested today, and if that's your qualification, you go back to work, and everybody else got tested, but then you come home or you go to a store and you interact with somebody else, that can give you a false sense of security. So what I think when we talk about testing and a restart, what we are talking about is the ability to box in the virus in real time. Not that you could do it one way, right? And hypothetically, it could work. You test everybody in the community. You quarantine everybody that needs to be quarantined after investigations, and you isolate everybody who's positive. You let that 2 weeks go, and hypothetically, if no one else came into the community, you might be able to starve the virus out that way. And I wish on day one we could have tried it. But getting a test, having it come back as a negative is kind of like a false instrument of security if you're not social distancing. So what is the new norm, what we believe, when we're living with this virus, because things are going to start up at some point, and we can talk about more about that, but is we need to have our COVID-19 tracking team here in Onondaga County with our health department, and they need to be able to work with primary care providers to maybe loosen the guidance on when you test somebody. And then we go and we do rapid testing when we have somebody. We get a positive back in hours, not days. Then we do our investigation and we isolate and quarantine. Boom. And if we're doing this in real time, the spread is less, even though your numbers may always be around, but the spread is less because you're able to move faster. So I think with testing, you can do antibody testing. We don't have it yet. That will tell you who's kind of immune to this potentially. That's interesting. But when we're living with this virus, it's more of having our COVID-19 team be able to track this, identify this quickly, and respond within a day, not waiting 3 or 4 days.
A few Central riders have reported some crowded buses on these limited rides that are running right now, which in a sense, it makes sense, but is there a way that we can control that situation and limit the number of people that are on these buses?
Look at there's a 6 foot social distancing rule. Everybody should be wearing a mask now. I don't know how much more we can do. People get mad at me when I say here, and I say it will be very hard to enforce some of these things. They get very mad at you. By making a rule or a law or an order, you get automatic compliance with more than half the population right away. That's why you do it, even if it's hard to enforce, because you know by saying that most people are going to do the right thing and comply. I don't know how the government operating at 25% of our capacity can enforce some of these things. And I just don't know how. And so in a situation like that, how are we supposed to react as the government? Who do you call 911? Do we find a sheriff and have him chase down a bus? Maybe, but I don't. There's things and examples that we cannot enforce. I would hope that Centro, that's kind of one of these things too. At some point down the road, when businesses open, there's guidelines and there's rules, and they're going to have to enforce them themselves or risk being fined. And that's what this is going to end up looking like. And so that's kind of a central problem. They need to self-regulate that, because it's very hard for law enforcement to regulate that when you're dealing with the realities that we're dealing with. Questions? I think we have affiliated cases related to potential nursing homes, and one potential residence I believe we have an affiliated case with as well. So where you have areas of density, you may have some affiliations with those areas of density in two of the areas there. So that's kind of skewing some of the data.
Those affiliated cases aren't under the household contacts that you keep listing.
Correct. Contact case is one, affiliation is another. So we're seeing more activity in nursing homes. And so that's going to drive density. It's going to drive more positives. And I believe there was a residence building that also had affiliated cases within that apartment residence. And that's what drove some of the density in another part of the city.
Ryan, the President of the United States tweeted a major news conference tonight at 6 o'clock, guidelines for opening up America again. What do you hope to hear from the President, and what do you hope he leaves to local and state governments?
I think so. I saw some of the governor's press conference, and I'll be interested to hear what the President has to say as well. My plea to both governments, which are larger than ours, which most people do, whenever the President or the governor says something and they make a rule, a lot of people think that I made the rule. So I get emails right after, usually angry about what they do. What my plea to everybody is in Central New York, we've been working as a region, and I've been talking to Tony Pacenti in Oneida County every day. And Mayor Walsh and I have a unique relationship and a special relationship where we're working together every day, talking to the leaders in Madison County and Cayuga County and Oswego County. And we are going to work together with our business leaders and our healthcare professionals and our public health professionals and Dr. Gupta, and we're going to come up with a plan on what a restart looks like together. And we believe that Central New York needs to work together moving forward in emergency management type responses related to this issue. How can we work better together in the future? But we'll put out a plan to the state of New York about what a restart looks like and what makes sense for us based off of data. And so we heard certain dates today, May 15th, with the governor's New York pause. I've also heard him talk at times about different parts of the state might be able to be treated differently than others. So I don't know when a restart will be ready for in Onondaga County or Central New York. The data is going to drive that, but we're planning and preparing for that now together. And at some point, the data might merit that discussion before a May 15th date. So we're planning, preparing. We think our region has not been impacted the same way other parts of the state or the country have. We will work together just like the states have worked together, the Northeast, and with counties. And we just want to be treated as a region. And if somehow the data shows we're ready before Long Island or New York City, which I think it will, that let us come up and let us implement our restart plan at that point.
Ryan, you mentioned that a negative COVID test could give you a false sense of security. In your plan for nursing home workers, are you looking at like periodic tests, like once a week? Or?
Yeah, I think right now, and that's a great point. But right now, we just really want to find out if we have a problem that's sitting there that we don't know about. I think with capacity, you can do these things, and I know we supply tests to Loretto. They have capacity to go do different testing within their own operation, and so that's something we can look at, Tim. I think we just want to get everybody out right now and get them tested and figure out who's symptomatic that's positive, if anybody, who's asymptomatic that's positive, if anybody, so that we can control that spread before it happens. These are very vulnerable people. Our job in county government is essentially to help protect our most vulnerable, and so we take that seriously, and we want to help every way we can with our state partners. Other questions?
Do you have any indication as to what happened in Elbridge?
I don't. It's disappointing that the streak has stopped in Elbridge. I'll have to talk to the supervisor about what happened there, but I was disappointed when I saw that. It was a strange anomaly for a long period of time there. So Elbridge hung tough for a while. But now we got to make sure those two people get better and recover.
Are you under the impression new cases are still in the category of they could have been preventable?
I think that they're right now we're at the point where we're trying to understand the data more, and there's more affiliated cases now. So I don't think those are necessarily, look, at any time you have an employee going to work when they're sick, I would say that's preventable. How many of these cases where people were asymptomatic, we won't know, right, that led to positives. So I think right now we're seeing some affiliations with some cases, which has pushed our numbers up a little bit. We want to understand those affiliations because once you can address those affiliations, then you have a better idea of where the community spread really is. And if half your, and I'm giving you an example right now. I'm not saying this right now, as far as this is what's happening here. But if half of your cases are affiliations, under that example, once you control that affiliation and you solve that problem, your community spread is smaller than what it actually looks like. And so right now, we think this week there's been a lot of affiliated cases. We're trying to get a deep dive in on that data. Again, I don't see a lot of this data. I can't put my analytics team into the health department analyzing this data because of HIPAA. So we have to let our health department box in the situation first, identify, isolate and quarantine before they can really do a deep dive on the affiliations first. So we've had 20 plus cases yesterday. We have another 16 today. So they got to do that first before they can get me the report. So they know what I'm looking for.
When you say affiliations, is that family members that live in the same home?
Or if you're in a case of a nursing home, an affiliation is you work there and you infect patient A, and then you go and see the next patient, you get them. Or if there's some sort of communal activities, we infect patient A is with 5 other people, all of a sudden they get it. So when you have that density, there's nobody else visiting nursing homes. There's no visitors. So That's the challenge with nursing homes.
Is the uptick we've seen because of nursing homes?
There's more nursing home cases this week.
When you say affiliations, you don't mean people having social gatherings that shouldn't be, though.
That would fall under affiliations too, but what we're talking about is what we believe is driving the numbers this week are nursing homes. We're trying to complete that and be able to report that accurately. But yeah, I don't know if there's people who are having parties over the weekend and now we got cases. Maybe I didn't even think about that. But right now, where we see problems, when we start to see these affiliations, does a public response, is that effective if we put resources behind it? In most cases, it's not, because 10 people are at the same party, they all got each other sick, the party's over, right? But if it's a situation where it's happening in a building or there's other buildings like that building, then you can use your resources and be proactive in those other buildings, and then use your resources to get the building under control. And
Do
that's,
nursing homes have the infrastructure to isolate COVID-positive patients, or is there a process to move them to protect the remaining?
they do have the ability to isolate and in their own buildings for the most part. So they do have that ability.
How concerned are you with an outbreak at a nursing home when that population is so much more vulnerable than the rest of the county?
I'm very concerned, and I normally, you wouldn't be asking to get into another government's lane like I am if you didn't have that concern. I want to help. I want to give my health department resources, all of our offices resources, to get out in front of this before it becomes what I've seen. I've talked to county executives who are my friends in other parts of the state, and this is the issue in their communities, is their nursing homes. And so we have not had the type of outbreaks that these other counties have had. I don't want to have that. So how can I help get out in front of this and use our resources to protect our residents here?
What does that mean? What is resources? Obviously testing employees proactively, but beyond that, what can you do?
Yeah, I mean, look at part of when you test employees, if you have positives and they're your employees, they're going into an isolation. So who's going to help take care of the people in the nursing homes, right? So there's got to be a plan for that. And so we're willing to help work on that plan and backfill with personnel if we have to, any way we can, to help save lives.
I think you've answered this, but of the new cases this week, or do you don't have a rough percentage of how many are in nursing homes?
Not yet. We will. When I have them, you'll have them. Okay. Any other questions? I want to thank Dawn McElwain and Debbie Kelly. They donated huge boxes of baked goods from Harrison Bakery to my health department and emergency operations center today. Those of you who know this know that I'm on a keto diet, and I did not cheat on the keto diet today, even though those Half Moon cookies look so good. So Dawn and Debbie, thank you for that. And again, it's a good way you can feed my nurses, and you can feed our emergency operations center folks, and still support a local business at the same time. So in a very sad day, that's a little bit of good news. Thanks.